Okay, I'm Dr. Martin Rutherford. I'm a certified functional medicine practitioner, chiropractor. This is
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
We're going to talk to you about, is eczema related to gut bacteria today? And for those of you with shorter attention spans who don't like to watch our whole 30 or 45 minutes, this one looks like it might be a little bit shorter than most. Those of you who have watched any of our videos, probably would be difficult for you to have listened to one without hearing us at least allude to gut bacteria. And years ago, the gut was really the gut. It was, oh, I got a bad gut. I got a colonoscopy. Everything was good. I don't know why my tummy still hurts. Then it's, then it was probiotics, and we can get into probiotics at another time and the nuances of that, because that now has brought the gut a lot more attention, because there's so many advertisements out there, so many commercials, and so much communication on it. And indeed, through our experiences, we started to understand ourselves just how powerful it could be if you could evaluate gut function, truly really clean it up, all of the things that were involved in doing that. And we would start seeing a lot of different positive effects from that. We would see positive effects in people who had rheumatoid arthritis. We would see positive effects in people who have MS. We would see positive effects in pretty much everybody whose gut got cleaned up, but it wasn't always the same positive effects, which is kind of interesting. So we're going to talk about gut bacteria and eczema, because certainly we have had people who have come in with eczema. And I would say it's an unusual case that comes in here for eczema. Another one of those things where they have fibromyalgia and eczema, they have psoriasis and eczema, they have a bad gut and eczema, they have other allergies that they want to get rid of in eczema, and don't really come in for the eczema, which is also kind of an interesting thing. And have seen consistently the eczema to respond to certain protocols, and the gut seemed to be a key factor there. So today we're going to briefly, I'm saying briefly, it looks like it might be a relatively brief subject for us long-winded guys, of eczema and the gut bacteria and specific bacteria involved. There's 4 pounds of bacteria in the gut, and we know about maybe that many of them when it comes down to it. But it's kind of interesting, because now it's getting so much more attention that more and more data is coming out on the gut more frequently than ever before. And it's kind of reflecting a lot of what we've been seeing for a long time. So relative to eczema, why don't we give an overview of eczema, what it is, maybe how it differs from psoriasis. A lot of people have a confusion with that. And then we'll go on with the rest of it, the data. And I like the part about ties to not having a vaginal birth. That's very interesting connection. And I think it's one that you'll might surprise you. Frankly, there's some people out there who won't surprise. I was talking to somebody about something similar to this the other day, and the patient started schooling me on cesarean sections. I thought that was pretty cool. So, because she was right.
Excellent. Relative to eczema, eczema is an autoimmune, they call it atopic dermatitis. So in essence, atopy means that you have an immune reaction that is out of proportion to the stimulation to the immune system. So what does that really mean? It means that maybe you put on a lotion and all of a sudden you develop eczema throughout your entire body, or you just have this rash that seems to persist, and your dermatologist says it's eczema, meaning that it's not psoriasis. As Dr. Rutherford and I were discussing before this broadcast, psoriasis tends to be a skin lesion that's on the extensor surfaces. So these are extensors. The fronts of your knees are extensor surfaces. Psoriasis has different manifestations though too. So really, to get diagnosed, you have to see a dermatologist. Doctors of all different disciplines will usually say, that looks like a rash, go to a dermatologist, because they are the ones who can biopsy skin reactions. They are trained for many years to figure out what is eczema and what is not. So that's point number one. Now, the overview on eczema is such that the research really started back in 2001, demonstrating a link between the gastrointestinal tract and these atopic skin reactions. So they started seeing changes in microbial diversity in the gut of eczema patients versus normal healthy controls, which is pretty interesting. So eczema patients have different bacteria, and really they have less diverse bacteria. And this is really an unequivocal point at this moment in time, if I repeat that too many times. And the issue is that people are trying to say, okay, well, we know that there's a bacterial diversity issue. Let's give them probiotics. We want an intervention to fix this problem. Unfortunately, it's not that simple. So with all the studies coming out showing that eczema patients may have a decrease in this type of bifidobacterium, and another study comes out and says, well, eczema patients have a decrease in actinobacterium. And then other studies come out saying, well, fusobacterium is low in this patient population. We also see in eczema patients that these bacterial populations can change through time. For example,
I'm going to interrupt. That's not to say that you couldn't take a probiotic and improve.
Well, I'm going to get to that.
Okay. All right.
Yeah.
I can see, I'm just feeling the probiotic
right. Yeah, absolutely.
vibe coming through, going, I took a probiotic and my eczema got better. So just know, okay, so he's going
to get to that. Yeah.
Okay, cool.
And we see that with these studies looking at bacterial diversity, for example, in infants, a lot of studies have been done relative to infants who have IgE, atopic forms of eczema. And they see that at 1 month of age, they have a decrease in certain types of bacteria. Same thing at 6 months, but by a year, they don't have a decrease in those same amounts of bacteria, but they basically still don't have the right bacterial diversity. I say all this to say, because from these studies, the probiotic group and the probiotic groups are coming out saying, okay, well, we need to give actinobacteria to this group of eczema patients because this study showed that it's low. Or we need to give bifidobacterium adolescens to this group of eczema patients. What we're seeing, a study came out of China where they evaluated every study performed in this regard, and they did a meta-analysis as it's termed, and they did see that using probiotics can be beneficial. However, this is highly contested because other studies have come out where they have given eczema patients certain types of probiotics, and though they improved, they really didn't improve much more than individuals with eczema not taking probiotics. So it's a complicated matter, and as we've talked about in our other broadcasts relative to the gut, it's a multifactorial problem. So the gut is a very fluid environment, literally and figuratively. And so if you just want to put a probiotic in there, that may not have all the ramifications that you think it would. And that's why it's so hard to study the gut from a randomized clinical control placebo-based trial.
There's so many factors.
There are so many factors, exactly. And so diet, for example, is a huge factor relative to microbial composition in the gut. Stress, as we talk about in a number of
Who checks people for stress hormones when they put them through a research protocol to see if the stress is damaging the inside of your gut and continually perpetuating this bacterial imbalance? Nobody.
True. And so we've done whole broadcasts on the relationship between the brain and the gut and leaky gut and things of that nature for that purpose, like Dr. Rutherford is talking about, because when cortisol is high, as Dr. Rutherford is saying, then that can actually break down the barrier of your gastrointestinal tract, leading to increased immune activation to different species of pathogenic inflammatory bacteria, for example, in the gut of an eczema patient.
So those of you who have taken probiotics and gotten an excellent result probably have less mitigating factors than, I will say, the average person who gets eczema.
And especially at that point in time.
Especially,
At that moment in
exactly.
time.
So maybe you're not stressed, maybe you're relaxed, maybe you're on vacation, maybe
you're on a different diet at that point.
I was just going to say maybe you've changed your diet and all these different types of things, and that affects the bacterial population, and then maybe you're the lucky one that hits it right with the probiotic and you feel better. It can happen, and it does happen. But I just wanted them to understand the complexities of it, because everybody that attacks us, it's very black and white. It's like it usually isn't really understood all of the different moving parts. It's like they said take a probiotic and that'll be it. Is eczema not an autoimmune issue?
It's kind of an autoimmune issue, kind of not. It depends on the type of eczema. Some types of eczema are IgE mediated, which is more an immediate inflammatory hypersensitivity type response within the immune system, similar to like a hay fever. So some eczemas are of that.
So those types of eczemas have one more complication.
And then there are other eczemas that can be triggered by certain lotions that you're putting on your body, or a deodorant, as was recently publicized relative to one, probably our biggest selling form of deodorant in this country was attacked legally because it was being shown to cause a rash in the armpit of many people who are using it. So that's a type of eczema, atopic dermatitis. So that's kind of the data there. Now, moving on to where eczema really stems from, a lot of these studies went back to infants, infantile eczema, which seemed to have a particular focus on how these kids were birthed into this world. And so they started studying at-home births versus births in the hospital versus cesarean sections. And what they found is that children who were born at home had a much less inclination towards having eczema versus those kids who were born in a hospital, versus especially those kids who were born in another site where they're looking at cesarean sections. So there's a lot of talk about the bacteria you're getting from your mom when you're being born into this world, because it's called meconium. So you're getting this confluence of vaginal bacteria, some fecal bacteria coming into your oral tract that's going to populate your gut. And the one factor they saw that if your mom has eczema, then probably you're going to have eczema too. There's an inclination there because you're going to get her bacteria. But otherwise, they showed that vaginal bursts, and these are all coming from very high regarded journals in the immunology and allergy world that we attach to our broadcast today. So for those of you who are scientifically minded, we recommend you go to powerhealthtalk.com. You can really dig out each one of these articles and see kind of the nuances of what the researchers are seeing and also what the allergy community is seeing. And this isn't just like an alternative, a thought process. This is coming from allergy journals where allergists who are in basically research are saying, why do so many people have eczema? We got to get to the cause of the problem. And so in doing so, they are finding that there are these changes in the bacterial relationships of all these kids.
Yeah, we are getting a more sick patient population, whether you want to realize that or not. I think it's, depending on who you're looking at, 130 to 160 million chronic pain patients in our country today. There's a ton of things that can contribute, but we're seeing kids with Hashimoto's thyroiditis at 3 years old. We're seeing kids sick at young ages. There are multiple reasons that are being put forward for that, but this is a very powerful one that's being looked at. Also, they're looking at things across the placenta, stress hormones that across the placenta. I think you did something on that at one point in time. And then C-sections. I mean, it's almost like C-sections should only be done for emergency only, because of what Dr. Gates said. To put in English what he said, when you're coming through that canal, you're getting all of your mother's vaginal bacteria in your mouth, and it seems natural that your face is facing, not to get gross here, okay, the rectum, and then you're getting fecal contents. You're gaining immunity to your mom, okay? But you're also stimulating brain cells, correct? So vaginal birth is a good thing. That may seem like weird to say, but it seems like we've lost all common sense here these days. Somebody's got to go on vacation, so they deliver the baby differently. And we can't, not sound like too old schoolish or whatever you want to sound, but you can't mess with nature too much. And in this particular case, it's like Dr. Gates said, this is not an alternative medicine type of this is something that's been studied for. I was reading a book not long ago on it. The book's 10 years old, and they were talking about it back at that point in time. So anyway, yeah. So there's that. So that is eczema, gut bacteria.
And a lot of these studies are being done because eczema is increasing in frequency. So again, it's just like all these other autoimmune conditions that we talk about on a weekly basis, from Hashimoto's thyroiditis to different forms of other autoimmune conditions. And here we're talking about eczema, and they're saying, why is it becoming so prevalent? Well, these are, let me say it this way, deviation probably from the natural way of doing things is probably a big reason why we're seeing such an explosion in these autoimmune and other diabetes related illnesses, because foods are different, in terms of what we're putting into our body for antibiotics. We're not blaming one thing, stress hormones, potentially we're a more stressed out society, and we're not delivering kids how they naturally should be delivered.
And all this affects your gut bacteria.
And we're not saying not to have a cesarean, but we are saying that, like Dr. Rutherford says, are you having a cesarean because the doctor has to go on vacation? And they're basically just doing it to get it out of there. It does happen. So,
or people want to take it because they don't want to get out the door, or they want to feel the pain. Hey, I'm a guy. I've never had a baby. I know I can't say it, but I'm telling you what the facts are, and that if you can handle it, vaginal birth is the only way to go. If it's not like some sort of a medical reason for doing it. It's one more piece to the puzzle that we can maybe start to dampen these immune responses. And the solution is simply fix the gut, calm down stress mechanisms.
Yeah, the solution is, this is what we look at.
General?
Yes, stress is number one. We look at stress hormones because so often when people are attempting to repair the gut, they are not attentive to the individual stress levels, history of stress, history of childhood trauma, what their basically fight-flight responses are on a consistent basis, even if they don't seem as though they're stressed out. So that's number one.
If you're a person who can't go to sleep, you wake up in the middle of the night, can't get back to sleep, you're probably suffering from an overreactive stress response, whether you think you're stressed or not.
True. And then we next look at what is the microbial diversity in your gut. We look at the barrier integrity between your intestines and your bloodstream. It's a semi-new phenomena in the last 2 years, but it's a fantastic piece of testing to do because it really tells you is someone's gastrointestinal tract, for all intents and purposes, like Swiss cheese, or is it a nice sound barrier? And when people have a sound barrier, it seems like in our experience, and the literature supports this, that the incidence of autoimmune disease and inflammation coming from pieces of bacteria goes down. Again, we go back to microbial diversity. And then we look at diets in terms of, okay, what is your diet doing to help your gut to have a good level of barrier integrity or hinder that? We also look at diets from the perspective of what is your diet doing for microbial diversity and your particular symptoms. If you're on a paleo diet, but you're having intense bloating, diarrhea, and cramping, probably not the right diet for you because you may be eating lots of vegetables that are inflaming your specific bacteria. So these are just examples that we would look at clinically. Then from there, we look to see how your body is detoxing foreign substances out of your body. So we have to evaluate, do you have a liver that doesn't have one of the biochemical pathways working to flush out that skin cream that you put on your body to get it out of there. So that is our diagnostic flow for an eczema patient.
Yeah, and well, I'll divert to you on this. That there are tests out there, there are fecal tests out there that tell you about the different microbial populations. And maybe I'm going to say it's wrong, but there's a lot of stuff we don't know about the microbiome right now as far as microbial populations. Like there's probably 4 pounds of bacteria on average in your gut, and so these tests.
Yeah, so
I mean, a lot of people watching this probably are somewhat alternative minded. A lot of them may say, "Ooh, I'm going to go get that test right away." We've used them. We don't
those
use
tests
them
are
anymore.
right. Yeah, we used to use
I'm
a
just saying.
specific test that was looking at genetic markers. So they were basically trying to genetically figure out which bacteria were in the gut. Because the problem with the gut bacteria is that it's an anaerobic environment. So most of these bacteria used to grow without oxygen. So if you wanted to do a stool culture and then played out which bacteria have, it's semi-useless because that's not an accurate representation. So the new testing that they're using in research are genetic-based tests. Clinically, we'll say this, we lost the best genetic-based test that we had a couple of years ago because they were bought out by another company. So we haven't found there to be a really, really accurate test for assessing microbial diversity like we used to have.
Right.
So we have to go off probabilities now based on what we see in the literature. When I talk about assessing gut bacterium, we also look at how people respond to different diets based on the literature. We know, okay, if someone's getting inflamed eating this, there's a good potential maybe they have this bacterial relationship.
And I just threw that in there in case you've already gotten those tests and you were treated by those tests and your eczema hasn't changed and you're going like, no, well, I did that and it didn't work. It's the bacteria in your gut. The research is clear on that. We've seen it clear up. So it's just that you need to kind of more investigate the things that Dr. Gates just kind of reviewed for you. So, all right.
So that's this week. Thank you for the individual who requested this topic.
Oh,
yeah.
I didn't know somebody requested it. Cool.
And if there are other requests, let us know. You can message us at powerhealthtalk.com, I believe. You can comment there. And then you can access all those articles. Just search eczema on powerhealthtalk.com. The articles I attached to today's broadcast are there. And we'll see you next week with something else interesting.
Next week.